Let's talk about the tug of war that's going on right now between hospitals and the insurance companies, and the fact that you're holding the list of a lot of hospitals that are saying bye-bye to Med Advantage.
So Multicare, which is based in Tacoma, Washington, stops contracting with all Med Advantage PPO plans for 2026. Providence Clinic is dropping United Healthcare in California. New York City's Mount Sinai, no longer in network with Anthem. UNC Health has suspended its network with Humana, WellCare, Healthcare Services, which HCS was previously Cigna. Lehigh Valley Network dropping. It just goes on and on and on and on.
What's the big one?
The big one is Mayo Clinic. Not that they have the most clients impacted, but they're considered our best hospital.
Absolutely. If something happens, you're going to Mayo.
And yeah.
And they didn't used to take Advantage.
So they didn't. So consider National Medicare Advantage is 20 years old. Happy anniversary. That for most of that, they didn't take Medicare Advantage. But then they got some contracts with United, and we're like, yay! And then they got a contract with Humana, like, this is great. They're expanding. And they had some little regional carriers, and now for 2026, they're like, we're out. We don't need it. So there's so much demand. They don't need to take a reduced reimbursement.
Absolutely.
Right?
Absolutely. So why do you think this is happening? Reimbursements.
It's money. The answer is always money.
Always money.
So they have enough demand. They don't need these clients. Now, smaller hospitals stay in network because they die. And the president of the American Hospital Association last year, he said, we're losing money on Medicare Advantage. He said, but we can't not be in network, as a nation. So we're just going to race to the bottom. Like it's hurting the hospitals.
Right.
So that was interesting. It only matters to you if it's a hospital in your area, like St. Luke's in Idaho. Like, okay, well, now nobody's in network. It's like, well, now what do you do? Go to Medicare Supplement. If you have a path to Medicare Supplement, if it's a time of year when you can move to Medicare Supplement, because these contracts don't all terminate at nice times.
Yeah, and that's a problem. All these contracts should start January 1. We should at least have something unified that we and our customers can depend on to have like an up-to-date directory January 1. How many hospitals were listed there that were dropped?
So this is just 26, but there's more. And it's always changing. So that article's already a month old. So there could have been some being dropped today. The problem when the client's locked in, but the network's not locked in, is the agents look like they bait and switched you.
Yeah, they don't.
Because as an agent, we did our due diligence. What hospital do you prefer? What doctors? What specialists? And we're like, great. These two plans meet your needs. Which one do you prefer? Help enroll. And then a month or two later, they get the notice from the hospital, hey, you can't come here. And they're mad at us, which generates complaints to Medicare. And there's nobody on our side saying, this is not our fault.
Right.
We need to stop this at the carrier level.
Why do you think that some hospitals are saying no to some carriers like Mount Sinai, no to Elevance? But everybody else is good.
It's all money in different forms. So some carriers have a higher rate of denial of prior authorizations, which then get appealed and then get it approved, unappealed.
Yeah.
So it's just added cost and labor. They're like, some carriers are worse about that. So some hospitals like, we're done with you.
Just stop messing with it.
Yeah, we'll take you.
So bad.
And the new guy always looks good until the new guy starts taking a page from the other guy's playbook. So prior authorizations is a touchy point. So it's not just that their reimbursement was lower with one insurance carrier versus another, but it was how that insurance carrier acted. So with prior authorizations, last year they met and they said, hey, we're going to voluntarily make this better. And they're starting in January, we're going to have, I think they said like 300 drugs won't need prior authorization. And we're going to reduce the amount of prior authorization required for, it's not required. They just voluntarily got together and said, we're good guys now.
Right.
So we're waiting to see that in practice. That would help calm down the temperature of these hospitals being so mad. But that doesn't help us when it goes out of network. We can't say, well, it's in flow and it's getting better and we expect it to get better. They're just like, what the heck?
The heck is happening?
I can't see my doctor.
It's just one more thing and it's changing. But there's industry.
There's no part of that you can anticipate or preempt. We have no line of sight. When does a contract expire? I remember 20 years ago trying to find that out. Like, is it going to expire mid next year? Do you have You just signed a 5-year what do I have to look for? Especially if you're in a small market, and I'm specifically thinking back in Fort Wayne when Parkview, being the biggest hospital, was having negotiations. And I was thinking, okay, they came to an agreement, they signed. It was very dirty and messy, but they did it. But they don't tell us, is this a 1-year contract, a 3-year contract, a 5-year contract? They don't give us any heads up, which would be really helpful as an agent. If I know that contract's due to expire here any month before I put somebody in it and tell them, you can go to the hospital that's 5 minutes from your house instead of the one that's 2 hours from your house.
Drive to Indy.
So the only thing you can do is explain how it works. Explain that you have no control over it. The better relationship you have with your client, educating them about this will prevent them from complaining.
Absolutely.
Because they can't complain about you. You didn't have anything to do with this. And if you did a good job educating them, they will know that. If you learned something today, please hit the follow button. Join us next week. We'll keep you up to date.